Welcome to Transitioning to Medicare Part 2. Hopefully most of you have gone through Part 1, which talked about your enrollment and getting onto Medicare. Today, we are going to be focused slightly differently. So I'm from the SHIP office, that's the State Health Insurance Assistance Program. We are local help with no cost to our beneficiaries and confidential. We are trained counselors. So there is one full-time employee, and then the rest of us are volunteers, but we go through training and we have to be tested on that training. We can provide everything from education, such as what we're doing today, to one-on-one counseling. That you would call our office and set up an appointment. We can do benefit program reviews. That's not only reviews of Medicare itself and its offerings, but secondly, if you want to compare it to a retiree plan, for instance, as long as you have the information you bring with you, we can sit down and help you look at them side by side. We can do application assistance for financial assistance programs, and we can help you with problem resolution. It is available to all Carroll County residents. If you know someone in one of the other counties, this is a program that is true across the nation. It's either done by county or region. If you know somebody in one of the other counties in Maryland, this is just information you could pass along to them for how they would contact their county office. In addition, if they're out of state, you can just send them to the Medicare.gov site and it'll give them an opportunity to look for their SHIP office. So what are we going to talk about today? We're going to talk about the gaps in Medicare. We're going to talk about Medigap coverage of those gaps and other ways that you can supplement Medicare, such as Medicare Advantage or health plans, Medicare and Medicare Savings Program to help you financially, possibly on that. We will also touch on healthcare fraud and abuse. So some of this you will have heard in Part 1, but as a quick review, you can either be on the left-hand side of this chart or the right-hand side of this chart. You cannot cross over between the two. In Carroll County, we have a lot of folks under original Medicare, especially if they can afford a Medigap. So original Medicare, the reason they choose that so often is that there are sort of defined costs. They have a pretty good idea of what their medical costs are going to be for the year because they're going to pay a Part B premium. They're going to pay, if they have a Medigap premium, and the Part D, your prescription drug coverage, we can run a program for you and tell you exactly what that's going to cost you over the coming year. In addition, under original Medicare, you can go to any doctor, any facility that treats Medicare beneficiaries. If you choose to be on the right-hand side of this chart, then you're looking at a Medicare Advantage plan or similar type plan. And these are going to look more like your employee coverage plans. So they're going to be regionally based with a network of doctors and facilities. Could be an HMO. With an HMO, if you go outside that network, you have no coverage. You are paying all the costs. If you pick a PPO and go outside that coverage of in-network, then you will actually have coverage, but you will pay more than if you stay in-network. Medicare Advantage plans are going to combine your Part A, so your hospital, and Part B medical insurance, and most will have a Part D prescription drug plan included within them. Medicare Advantage plans will have an out-of-pocket spending limit, and they also will cover some things original Medicare does not cover, such as getting your eyes examined to get a pair of glasses. So things under vision, hearing, and dental. On the left-hand side of this chart, your Medigap acts as your sort of safety net, if you can afford one, to pick up your co-insurances and deductibles, depending on what plan you pick. On your right-hand side, you have that out-of-pocket limit on your spending. So it really depends on your medical coverage, where you spend your time. For instance, if you are a person that spends 3 months of the year in another state, A Medicare Advantage plan is unlikely to be your best choice because you may not have any in-network coverage and probably won't in many of the places you might be. So everybody's individual on this. If you choose a Medicare Advantage plan, you may not pick up a Medigap. They cannot be sold to you. So that can only work if you're under original Medicare. So just as a reminder, let's talk about what your costs look like under original Medicare. So for most people, Part A is premium free. If you or your spouse has worked 40 quarters and paid into FICA, then you do not pay a premium for Part A. For any of you that might not meet that criteria, you could choose to buy and pay a premium for Part A, but most people will have it premium free. If you're admitted to the hospital and you do not have any other coverage, then you are going to be responsible for $1,600 as your Part A deductible. After that, you're going to have 60 days of hospital coverage. If you need in a benefit period to be in the hospital longer than 60 days, you would start paying a coinsurance per day for the next 30 days. And if you need more than that, you would pay $800 per day. Those are that 91st and 100 through 150th day in a benefit period are considered your 60 lifetime reserve days. So that means that in a given benefit period, if you stayed longer than 90 days, you start working on those 60 days. So you might use 5 of them this year, and then 5 years from now, use 5 more, but you only have 60 across your lifetime. If you've been admitted to the hospital for 3 full days, and not including the day you get discharged, and had to go to a rehab center, the skilled nursing facility, you would have 20 days of coverage with no coinsurance. After that, you're going to spend $200 per day for up through the next 80 days. And again, this all is if you have no other coverage than original Medicare. A benefit period is tied to the calendar of when you had treatment in a hospital or skilled nursing facility. So if the last time you got out of one of those, more than 60 calendar days have gone by, you start a new benefit period. That says that you can have multiple benefit periods in a calendar year. It also says that if you meet that condition, you would be responsible all over again for another $1,600, and you start your day count again at day 1. You can see how, therefore, if you had to be in the hospital for multiple benefit periods in a given calendar year, how these costs could start to add up pretty quickly. So I'm going to give you an example of how this would work. If you were to go into the hospital for 10 days in January and come out, and do the same thing in February, and the same thing in March, and the same thing in April, you are still in the same benefit period, and you've now used 40 of those 60 days of hospital coverage that you have. However, if you were to go in the hospital in January for 10 days and come out, and not go back in the hospital until April, more than 60 days will have gone by, 60 calendar days. You now would be in a new benefit period. You'd be responsible for that $1,600 again, and you would start your day count at day 1 again. So that's how the benefit periods work. Part B, your medical insurance. And just as a reminder, or if you didn't attend Part 1, Part A was in-hospital treatment. You've been admitted and or like a rehab center and hospice, certain other items. But almost everything else, except drugs, is going to be covered under Part B, your medical insurance. So that's going to be your doctors, your labs, your x-rays, your durable medical equipment, cancer treatments, outpatient surgery, dialysis. All of that is going to fall under Part B. For most people, you will pay $164.90 per month for your Part B premium. It can be adjusted to a higher amount than that if you make certain income, above certain incomes. And I'll show you what that looks like at the end of the presentation. That will normally come, if you are already taking Social Security, that's going to come right out of your Social Security amount before you get it deposited into your bank. If, however, you're not yet taking Social Security benefits, then they will charge you quarterly 3 times that amount. So you'll get a bill for 3 times the $164.90. The first $226 you spend in a calendar year on doctors and labs, etc., you will be responsible for. After that, Medicare is going to pay 80% of that coverage. You'll be responsible for 20%. Unless you go to a doctor or facility that does not accept assignment. That means they haven't agreed to the Medicare rate. And in that situation, they can charge up to 15% above that Medicare rate. So to give you an example here, if you go to the doctors and that bill is $200 and the Medicare rate is $100, that's the amount the doctor's going to get. Medicare would pay 80 of that. Again, this is after you've paid your Part B deductible for the year. Medicare will pay $80 of that. You're responsible for $20 if you've gone to someone who accepts assignment. If you have not gone to someone who accepts assignment, Medicare is still going to pay that $80 against their $100 rate. You're still responsible for your $20, but you could be responsible for up to $15 more on that particular bill. A lot of people avoid this by asking that question up front. Do you accept assignment? And they choose to go to people who do. A great majority of the doctors and facilities do accept assignment if they treat Medicare patients. We've run into it in particular on things like some anesthesiologists, where you don't tend to have a whole lot of choice. But, that's just to be aware of that. So what do your out-of-pocket costs look like with Original Medicare? It really is going to be totally dependent on how much healthcare you need in that year. What type of healthcare you need and how often you need it. It's going to depend on whether your doctors and facilities accept assignment. That's that accepting the rate Medicare will pay. And it'll also depend on whether you have other health insurance coverage to back up Original Medicare. So this is where we get back to the Medigap policies. So Medicare Supplement insurance policies, you'll hear them called that, you'll hear them called secondary, you'll hear them called Medigap. These are private companies that have to follow rules that are laid out by Medicare. They're designed to fill in the financial gaps in Original Medicare. So that would be your deductibles and or things like your 20% co-insurance. They're not designed to give you separate services that are not covered under Medicare. So if you have something that Medicare does not pay for, neither is your Medigap. It only picks up after an event, a healthcare coverage of some type that Medicare has paid for. These are all standardized plans. So you're going to see all different costs for these plans. But if they have the same letter, then you're going to have exactly the same medical coverage. So you can decide whether a Medigap policy is right for you. So it can lower your out-of-pocket costs, particularly in a year that you have a lot of healthcare done. So Medigap policies will have a monthly premium, and you can only get a Medigap policy if you have Part A and B under Original Medicare. But you may not need a Medigap. You might have secondary coverage in another fashion. You might have it through an employer retiree plan, FEHB, etc. Almost everybody that has worked for city, county, state, government types of employers, they tend to have pretty good retiree health benefits and typically are not going to need a Medigap, for instance. You should always look at it on your own, but you usually would not have one. VA, you actually could use either your VA or your Medicare. You can't use one to back up the other. You can use either or. So, these are things you need to look at on your individual situation. If you have no other coverage and want to consider a Medigap, these are the plan types that you could choose from for a Medigap. If you look on the left-hand side of this chart, you will see the amounts that we showed on the deductibles and coinsurances on the earlier chart. If you go across and there is an X in that particular row under that column, it means that plan type pays that for you. In other words, if you've paid your premium, it's going to cover, for instance, that $1,600 if it's got an X there. Or, for instance, it'll cover 50% of it or 75% of it. If you go down these, you will notice that the Medicare Part B deductible, the $226 that you spend at the beginning of the year on any kind of doctor or lab, etc., none of these cover that anymore. And that's effective unless you turned 65 before January 1 of 2020, then you cannot choose a plan that would cover that. It's not really an issue because the plan that would cover that cost you more than $226 more than a plan G. So don't lose sleep if you're sorry about that. The most commonly chosen plans we have are G and M. If you look at G and look down through the X's, you'll find that if you pick a plan G, you will have coverage for all of those coinsurances and deductibles except that first $226. It also will be your highest premiums. If you now go out and look at M, it's going to be a lower premium than a G. You're still going to pay, of course, that $226 Part B deductible each year. If you look at the asterisks, we explain them down below. You're going to, when you go to a doctor, pay up to $20 of coinsurance, whether that's a primary or specialist. And then you will also pay up to $50 if you go to the emergency room and you're not admitted to the emergency, to the hospital. The other thing you'll be responsible for that you're not responsible for under Part B, under Plan G, would be the Part B excess charges. That's if you went to somebody who did not accept assignment. The rest of the coverage is the same as the G. You'll notice we have a G and then we have a G high deductible. That has become a more popular plan as folks have some assets they can go back to. And that would be people that have like a 401k or a 403b, that type of thing. The reason it's becoming more popular is because it is a much lower premium per year or per month rather than a plan G. You'll see the footnote down below. So you can think of this as catastrophic coverage. So if you pick a G high deductible and you don't have a lot of expenses that year, you will have saved quite a bit on your premiums, right? In a year that you have large expenses, whether that's hospitalizations or major surgeries, whatever, you will be responsible not only for the first $226 Part B, but you would be responsible for all of your coinsurances and deductibles up to another $2,700 in 2023. After that, though, you have total coverage, just like you would on a Plan G. So some people would rather keep the money in their pocket and, even if they put it aside towards that deductible, and pay a lot less every month for their premium. So that's something, again, that can be considered. Each company can decide which of these plan types they are going to cover, that they're going to offer. So how would you go about finding the right Medigap policy for you? You can go to one of two sites. You can either go to the Maryland Insurance site or the Central Medicare site. I would highly recommend for this, if you want to look at it online, that you go to the Maryland Insurance site. And the reason I recommend that one is because that actually lists your annual premiums, whereas the Medicare.gov will show you what's available in your area. It's not going to tell you what the premiums are. So for comparisons online, I would definitely go to the Maryland Insurance site. We can also, if you contact us or stop by either one, we can give you a book that has that printed out with the latest rates and who all the companies are and how you contact them. So who can buy a Medigap? Well, first off, you do have to have Medicare Part A and B. Secondly, because you're used sometimes to family coverage from employers and everything in Medicare is an individual policy. So if you each want a Medigap, you each have to buy a Medigap separately. However, some companies will offer household or spousal discounts. So you always want to read the footnotes to check that out. So what is medical underwriting? That's a process to determine your health status and medical history. During your own personal open enrollment period, you have something called guaranteed issue rights. The best time for you to buy a Medigap, if you want to buy one, is during your personal Medigap open enrollment period of those guaranteed issue rights. That is going to be 6 months, beginning when you are 65 or older and you've enrolled in Part B. This is one of the reasons, if people are working past 65, that they do not pick up Part B until they no longer have active employment coverage. They don't want to be paying that Part B premium every month if they don't really need it. And secondly, they don't want to be using their 6 months guaranteed issue rights and have it go away. The other time you have it, if you are under 65 and you're already on Part B because of disability, you may choose a plan A or D, are the only 2 plans you can pick, but you are eligible to pick one. They're quite expensive because they are treating folks that have disability and therefore they typically pay out a lot more claims. However, if you went on Medicare and picked up a Medigap because you were under 65 and disabled, you get a second Medigap open enrollment period where you get that 6 months all over again. And that's when you actually turn 65. Then you look like everybody else and they cannot do medical questions, etc. So if you know someone or if it applies to you, just make sure you take advantage of that second 6 month guaranteed issue right period that you have. So if you wanted to change Medigap policies after your personal Medigap open enrollment, you can apply anytime you want to the rest of your life. However, that company can require medical underwriting and you can be turned down, meaning they don't have to offer it to you. And you will typically be charged more because of any medical conditions or prescriptions you're on, etc. So this is a really serious thing you need to think your way through, because you don't get a lot of, you don't get extra shots at having that guaranteed issue right other than very specific situations. So if you believe you want one, you need to think about it and think about it seriously. You might be able to change your Medigap later, but you're not guaranteed that you can change it later. So even if you decided you wanted to explore other Medigaps or other plan types, then don't cancel your current policy until you have the new policy in hand. There are a few time periods where you can have guaranteed issue rights of 63 days, not 6 months. The link down below, the Choosing a Medigap Policy, is a wonderful book that I recommend anybody who's considering a Medigap that you spend some time looking through that book. It's going to reinforce anything I've talked about today and explain it in more detail than I have time to do on this call. You can get that 63 guaranteed issue right period if you have original Medicare and a group health plan that pays after Medicare pays. So those would typically be very small companies. If that plan is going away, then you get 63 days of guaranteed issue rights. If you have a Medicare Advantage plan that's no longer offered in the county and it's going away, you can't stay on it, then you have 63 days of guaranteed issue rights to look at a Medigap. There are 2 other times, and in both cases, these only apply for a year. If you've had a Medigap and you decide for the first time ever that you want to try a Medicare Advantage plan, Then if you decide in that first year you have that, if you've had it less than a year and you want to switch back, you can get 63 days of guaranteed issue rights. The other example is if you, as soon as you go on Medicare, decide you want a Medicare Advantage plan, and it's the first time you've done that, and you want to, again, within that first year, switch back to original Medicare, you'll have a 63-day period to do that. The book we reference here, and we give you the link for, if you look at page 22 and 23 of that book, it'll explain the guaranteed issue right periods. So Medigap policies also have something called a rating. They can be issue age, attained age, or community rated. And issue age, there's only one company in the state of Maryland that offers all their policies as issue age rated, which I'll show you the example. There's only one that offers community rated. All the rest are attained age rated. With an issue age rated, it's based on the age you were when you purchased it. In all three of these ratings, you can get an across-the-board increase associated with companies having to pay out more claims than expected, and they get approved for an across-the-board increase. But the difference between these three rating types is if you were a female and went in at 65 and I went in at 75, I will always pay a higher premium than you, because the premiums can increase, but they're not going to increase just because you got older. Attained age rated says that you know that premium is going to go up as you get older. And community rated comes up with one rate for men, one rate for women, non-smokers. And then everybody would be based on that particular rate for the same policy. Because that means you could be 65 or 100 and be at that rate, they give you a very large discount up front to make it competitive. So we'll walk you through that example. So these are 3 pages. These you could look at online, or these are 3 pages of the printed book. On every one of these where it says here, attained age policy example, you would have the name of the company. You're going to have how to get in touch with them by phone or online. And on the right-hand side, you're going to see where it says attained age in bold on the right-hand side. So I'm just going to walk you through an example. In this particular company, if you picked a G at age 65, what they would be quoting you is that 160, if you're male, the 167. You'll notice, by the way, if you go down to females, they're significantly cheaper. They're 145, and that's because women have better health. And so it's all based on claims that get paid out. So let's go back to the male preferred, because you'd be using preferred when you are under guaranteed issue rights. You would be at 65, you'd be $167. At 85, with no across the board increases, that number would be $286. That would, by the way, continue going up after age 85. They just take the table out that far. So a high G, as you can see, compared to a G, would be $60. So $107 less a month at age 65. And it's going to be $173 less a month by the time you get out to age 85. So, and again, that's the one where you would then pay the coinsurances and deductibles up to a certain amount. A plan N, as you can see, is somewhere between those two, 113 going to 206. So you're going to want to read the book. You're going to want to look at what your not only current medical conditions are, but what your family history look like. What are your expectations? Do you expect to have a long life? And, that'll help you make some of these decisions, not only whether you want an attained versus issue age versus community rated, but it also can help you decide whether you want a G, a high G, or an N. So while you're looking at some pricing here, I'll just give you an example. A G, remember, is going to cover everything except that first $226 Part B deductible in a year. If you pick an N, you're paying significantly less per month, and that might look great depending on what medical coverage you have. On the other hand, if you're somebody who already does or expects to possibly be going 3 times a week for dialysis, or 3 times a week for physical therapy multiple times in a year, 3 times a week for cancer treatments, you're going to be paying that $20 every time you go. So as you can see, that would quickly say your plan in with your copays is going to cost you a whole lot more than your plan G. So those are the kinds of things you want to look at when you're considering these things. The other thing you want to read in every case is, what does it say in the footnotes? So if you go down to the bottom, this tells you that you could have up to a 7% household discount being available. This is an issue age policy example. The only company in the state of Maryland that offers all their policies issue age is Transamerica. You will see a couple things in this chart. Number one, you'll notice they don't have a G high deductible. Again, that's their choice. They choose not to offer one. But if you look at the G, at 65, you're 178, and then your increases would be any across the board increases. On the other hand, if you were to get issued this policy at age 75 for male, it would be 284 plus any across the board increases. Again, you can see what a plan in would cost you here. And you'll notice in the upper right-hand corner that this is issue age policy. The community rated example, again, there's only one company in the state of Maryland that offers this, and that's United Healthcare AARP. So you'll see here that they have a rate for females, a rate for males, non-tobacco, and the base rate is the rate you would use when you are under guaranteed issue rights. So tier 1 and 2 would be rates that would apply after some medical underwriting. You will notice if you go to a plan G, it's for a male, it's $267, and you go, whoa, that sounds expensive. So what, again, you need to do is go down and look at the footnotes. They have both a multi-insured discount for household. Secondly, what they do to make this attractive to a 65-year-old is they will give you up to 39%. They will give you, 39% off of that rate. And they'll do that for the first 3 years. And then what they do is they don't change the base rate. What they do is they change the amount of discount you get. They're going to start taking 3% of that discount away each year until the discount you get is 0 at age 81. Then you'll be at what that base rate is. So I'm going to show you the example in this one of how that impacts you under the female G 237. If you apply that 39% discount, that's going to take that 237 down to 145. So again, you'll see that's then in the range of some of the other rates you're looking at. So this is why it's important to understand enough to think through, not only what type of rated system you want, community, issue, or age related, or rated rather, but also what plan type you're going to want, a G high deductible, and N. Again, you'll notice here they do not offer a G high deductible. There's a limited number of companies in Maryland that offer the G high deductible. So how much does your Medigap cost? Well, it's going to depend on a number of factors, which we've talked about. One is going to be your age. It's going to depend on which company you buy the policy from. It's going to depend on the type of policy, and that's your issue versus age versus community rated. If you are not buying it under guaranteed issue rate period, then it's going to depend on your health. And it's also going to depend on which plan type you pick. Again, we can send you the annual premiums booklet. or you can stop by and pick it up, or you can get it online. So it is an important decision. You want to compare the companies and their costs. You want to choose the policy that's best for you. And then whereas we at the SHIP office can enroll you in your Part D prescription drug plan, and we can also enroll you in a Medicare Advantage plan, you need to do your own enrollment on a Medigap. We can help answer questions, understanding around the Medigap, but you have to contact the insurance company. And that information is right on those pages in that book. You're going to contact the insurance company. Many people do it right over the phone, complete an application and buy a Medigap policy. And then as long as you're paying your premiums, you've got that policy. How do you enroll in it? You can do it on their website. You can do it by calling the plan. And you can do it, we can help you understand it, and then you would still enroll yourself. A lot of people like to call the plan because, they talk about this in the Medicare and choosing a Medigap policy. They call because while the coverage of the medical services is identical across everybody that offers a G or an N, they may say to you, if you ask them the question, well, why would I choose you? They may say to you, I have a 24/7 nurse service you can contact, or I give you a discount at local gyms, or that kind of thing. They can't offer other medical services, but they can give you some other auxiliary kinds of things. And so therefore, if you call the plan, you can become aware of what those might be. So that's original Medicare. Again, a lot of our people pick it if they can afford a Medigap because they've got the dependability of paying that Part B premium. They pay their Medigap premium. And then each year we can look at what their cost for Part D will be. But you have that alternative way of picking. And this is very popular in some states and counties, even less popular where we are, just because we don't have as many options and they're not as attractive in many cases as they would be someplace like Florida, where it gets very competitive because you have so many seniors there, right? So Medicare Advantage plan, again, is an alternative way of getting your Medicare. Still has to go by the rules of Medicare. It's combining your Part A and B and usually combining a Part D. Again, you may not get a Medicare supplement insurance or Medigap policy if you are under a Medicare Advantage plan. So Medicare Advantage and cost plans. You're still part of the Medicare program. If you go to the doctor, you're going to show your Medicare Advantage card, not your Medicare card, but it's still under the regulations of Medicare. You still get all the same Part A and B services. It's the cost that varies, not the services you get. And again, if you have an Advantage plan, you may not have a Medigap plan. So these are private companies again. All of these and the supplements and the drug plans all get reviewed for things like quality and fiscal stability and that kind of thing, right? In a Medicare Advantage plan, what you're going to be doing is cost sharing. So you're going to pay a monthly premium in most cases. Some of them actually have a zero premium. And you're going to typically pay a co-payment or co-insurance for each service. It does have an annual out-of-pocket limit associated with it. And it will have geographic limits. So these are regionally based offerings. Typically need to use a network of providers. Again, if you go outside that network for an HMO, you're going to pay all costs. If you go outside it for a PPO, you'll just pay higher than you would if you stay in there. And some of them will require a referral to see a specialist. On the other hand, you may get some extra services that original Medicare does not cover, such as some broader options on vision, dental, and hearing. Sometimes that's an added premium. Sometimes there's some included within the base premium. And you also, if you pick one of these, prescription drug coverage will typically be included. So when are you able to enroll in a Medicare Advantage plan? You can do that when you're first eligible. You can do that during your annual enrollment period each year, and we recommend you look at it each year. Again, October 15th through December 7th. That's going to kick in January 1 of the following year if you change your plan. And then there are some special enrollment plans. These are the 2023 plans that are available for you to choose from for Medicare Advantage plans. And you'll see we don't have a lot of PPOs, they're more HMOs. The two companies that offer PPOs in our county are Johns Hopkins and Humana. Just to get rid of a fear some people have, if you choose a Johns Hopkins plan, that does not mean you're going into Baltimore to get your treatment. There are people like LifeBridge, our Carroll County Hospital, many of the Carroll County doctors groups, are in network for Johns Hopkins and Humana. You need to check on those, but I don't want you to make the assumption it means you go downtown to get your treatment. That's not the case. There are also, if you look at the bottom of this chart, there are some plans that are available for people who are financially at a Medicaid type level of income. And those plans are only available for folks who are QIMBY eligible, full benefit dual eligible. So this is I know it's a busy chart, but this is something that I create each year for us to use just for explaining some of it. There is one standard deductible and coinsurance for original Medicare. For Medicare Advantage plans, they set their own parameters. So it's going to be different by plan. So I come up with this. You can get full details out on the Medicare.gov site. You can print out all the information you need on things that we don't even talk about on these charts. This is really just to begin to give you some view to have a comparison of your premiums, your coinsurances, etc., compared to what you would pay under original Medicare. So I'm just going to go across the top item there, which not because I'm recommending that, but just so you understand how to read this chart. Before I do that, I'm just going to tell you the two that are in pink are highlighted because there is no drug coverage under those two plans. If you pick an Advantage plan that does not have drug coverage, you may not pick up a Part D standard drug plan. So you either need drug coverage some other way or you're paying for all your drugs. But let's go across the top row for a moment. So your total premium you would pay monthly, assuming you have no financial help of any type, would be $69. The reason we list both the health and the drugs separately is because if you have Speed App, which we'll talk about later, it will cover up to $60 a month towards your drug premium. So for instance, in that first item, it would pay that $33.70. So your premium would now be $35.30. Down under the Johns Hopkins Advantage plan, the first one, you'll see that $63.80 of it is drug coverage. In that case, Speed App would pay $60 of that $63.80. So your bill would actually be $40 a month for that premium. The next column is just showing you whether there is a deductible for health or drug. The next column is your maximum out-of-pocket expenditure. So if all your coinsurances and deductibles, if you were to do a lot of treatments in that year, like be in the hospital, major surgery, etc., and you've spent outside of drugs $75.50 in that year, and you've stayed totally in network, then the rest of your medical costs will be covered that year. You would not pay more. If you've had some of your services in network and some of them out of network, then once you've hit that $10,000 level, you would be covered on everything. Again, you can see if you look down the column that can vary by plan. If you have outpatient surgery, for instance, so outpatient hospital, not urgent or emergency yet, we'll get to that in a minute, you could pay anywhere from $45 to $295 for in-network. And if you're out of network, you're going to pay 50% of the cost. Inpatient hospital, so you've now been admitted to the hospital. It's a different cost model. Instead of under original Medicare, you would be that $1,600 automatically. This is going to be $295 per day up through the first 6 days. So if you are in there, and I'm going to round numbers to 300 just because it's easier. If you're in there 3 days, you're going to pay $900. If you are in there 6 days, you're going to pay $1,800. So you can see that could be more or less than what you have under original Medicare. If you are outpatient, again, you're going to pay 50% of it. I'm sorry, if you are out of network, you're going to pay 50% of the costs. If you then ended up going to a skilled nursing facility, you've got those first 20 days again, and that's after 3 full days of hospital admission without the day you get discharged. After those 20 days, you're going to pay a co-insurance for the next 40 days in this particular model, and then no copay after that for the 60 to 100. If you look down below, that's not quite the same model as the Hopkins one. That you're going to keep paying across the 80 days if you needed them, the 80 additional days in the skilled nursing facility. So this is the one, this is a charge most of you will be dealing with on a more regular basis. PCP is just your primary care doctor. That's going to be, again, on the first example, $15. If you go, every time you go to a specialist, it's going to be $45. Unless you go out of network, then it's 50% of the cost. If you look down this set of numbers, you could see that could be for primary anywhere from $0 to $15, and for specialists anywhere from $40 to $50 in network. This is just some more of the cost you might incur. So there's no such thing as in and out of network for emergency or urgent. Wherever you go, they have to cover you. And for emergency, that's going to be a $90 coinsurance. For urgent, it's going to be $35. I'll just let you glance at the rest of these numbers on here. But just to give you an example, an MRI might cost you a flat fee under Hopkins at $250. Under Humana Choice, it's going to be $45 to $295 in network. So that just helps you understand how these charts work. I am not going to go through these examples because we would need a lot more time. What this is all of the HMOs that we offer, that are not we, but that are offered in Carroll County. And you can see some of them have, a more expensive monthly premium. Some of them could be as low as $0. But the other thing I want to point out to you is if you go out of network, you'll see that it says NA, and that's because you don't have coverage when you're out of network. You'll see also under, for instance, outpatient or inpatient hospital, if you go to the hospital and you're out of network, you pay all the costs. So I just want to point out that NA and the 100% on those. There's another option that you could consider, that some people are able to consider, which is called a medical savings account. If you look down where it says you may not join, then there are a lot of people that could not consider this as an option. So anybody that's got an employer or union retiree plan, TRICARE, VA, FEHB, hospice care, or Medicaid, any of those folks cannot pick this. But what this basically does is combine a high deductible insurance plan with a medical savings account. Any of you that had an HSA, it's somewhat similar to that. By the way, for all the Medicare Advantage plans, as well as this MSA cost plan, you will still pay your $164.90 a month Part B premium. That doesn't go away. These are premiums on top of that where there's a premium. These companies will then make an annual deposit for you to use on your health expenses. Depending on which plan you pick, if you look down below, that deposit would be either $2,000 or $3,000. You can use that money on a variety of medical expenses. You actually then have a deductible on each of those, which says while you can be spending the money that's already put into that account, it gets used against a debit type card. You will have also another $3,000 or $5,000, depending on the plan, deductible. And then once you meet that, all your costs are going to be covered. Again, outside of drugs. In this case, you can pick up a drug plan. If you don't utilize the money that's been deposited, it can accumulate across years. So you could actually continue to accumulate money there. So this is just another alternative way of getting your benefits. Those of you that are new to Medicare, which most people listening to this are, you probably have a Social Security account you've already set up. You may also set up and should set up a Medicare account. This is the welcoming page you're going to see out once you have your Medicare number and go into medicare.gov. Down on the left-hand side, go ahead and create your account. Once you've done that, there's a lot you can control out on that site. Everything from looking at running your drug comparison each year to figure out if you're on the best plan or Advantage plan comparisons. You can do it, we can do it for you. But this is where we would do it, is out on the medicare.gov site. You can view your claims. Also your Medicare summary notices. If you're like me and hate lots of paperwork coming out, you can choose to get that all electronically. And then you have an easy access to go back to, etc. You're not worried about when am I going to shred that, anything like that. Also shows you your eligibility and your preventative services. Easy to look up things versus flipping through a whole book. You can even choose to get your Medicare and You booklet that comes out every year. You can choose to do that electronically. Then you look at it all online and have search capabilities. So this chart, I could do probably an hour talking to this chart, which I won't be doing. Just want to make sure you know how to read this chart. You can take a look at it, and if you have questions about it, certainly, set up some time for us to talk you through it or call Central Medicare. So this is comparison of costs, everything from cost or out-of-pocket limit. And, I'll let you read through it and see what questions or answers it answers for you. So there's some information sources for Medigaps and health plans. You can call the Maryland Insurance Administration, or you can go out to their webpage. And that's where I would recommend, if you're trying to compare supplement policies, I would suggest you either call us and have us mail out a printed version for you, or come by and pick one up, or you can even print it out yourself if you would want to. You can do the comparison online, but it's a lot of information and probably easier for you to digest it from the hard copy on that particular item. Out on the Medicare.gov site, that's where you can run comparisons for your Part C and D plans, so your Medicare Advantage plans and your prescription drug plans. You can also look at the Medigap policies available in the area, but it does not have pricing for that. You can contact us and we can help you do any of this. And then you can also call into or look out at 1-800-Medicare, call that number, and they can walk you through and run things for you. Remember, though, there's a lot of people that are calling that number. The next question is, do you qualify for any kind of financial assistance? If you go down the left-hand side of this chart, these are 4 different financial assistance programs that exist. Medicare savings programs are considered. The first three are federal programs consistent across the country. If you go across a particular row, you will see there are income limits and asset tests. And depending on if you meet those, you would qualify for different things. So a QIMBY, somebody who's qualified Medicare beneficiary, they tend to be at about a Medicaid level financially, and they would be then able to get Part A and B premiums paid if they had a Part A that they had to pay. They also get other cost sharing paid, so deductibles, co-insurances. If they have a little more income, same asset tests, they might qualify for SLIMB. Those folks would have their Part B premium paid only. So those are designed to help on the medical side of Medicare. Social Security Extra Help is actually designed to help on the prescription drug side of things. You'll notice there's a higher income limit and there's a significantly higher asset test. If you qualify for QIMBY or SLIMB, you automatically qualify for Social Security Extra Help. That would give you help on prescription premiums, deductibles, and copays. You might be approved for extra help, even if you didn't qualify for QIMBY or SLIMB. We can help you fill out those applications and get them mailed in for you. We do have a fair number of people on the Senior Prescription Drug Assistance Program, which is actually a state program. As you'll notice, there's no asset test there. So that one is why a lot more people qualify, and it has a higher income limit. Each of you as a couple would be eligible for, you'd apply separately, but you'd be eligible for up to $60 a month towards your drug premium. So that could save you quite a bit of money across the year. It also makes you eligible for one extra switch in the year. So if you got a drug that's not on the formulary of the plan you're on, it would allow you to go in and do another comparison and actually switch drug plans. People that are in the first three categories could actually switch up to once a quarter. Just to make sure you're clear on asset versus income, for those of you that have a 401k or that equivalent, some kind of IRA, that is an asset as long as the money is sitting in there. Once you start taking distributions from that, you still have whatever's left in that asset, but you also have an income that's coming to you from that distribution. So that's just for your awareness. We are also Senior Medicare Patrol. Medicare loses up to $60 billion a year in fraud, errors, and abuse. They've done a whole lot of things to get rid of that amount, and the people out there are very smart and keep coming up with new ways to go after those dollars. So we need your help to keep this solvent and keep it around. You need to protect yourself from Medicare fraud and abuse, and that is really looking at your Medicare card number like a credit card. Don't leave it laying around. Look at your statements to make sure that there hasn't been identity theft. Be aware, Medicare will not visit you or call you to sell you anything. So if someone tries to do that and they tell you they're Medicare and they're asking for your Medicare number, don't give it to them. You're only going to give that Medicare number out to your providers. And if you call Central Medicare or ourselves, you're going to give it to us, because that's the only way we can look up your information and help you. Do look at your Medicare summary notices. That's what says what Medicare has paid for on your behalf. Check it to see if there are any services you didn't get, or things are double billed, or things that your doctor didn't order. If you notice a discrepancy, the first thing to do is call the provider. Sometimes this is as simple as a keying error. If it's not that, you want to gather the information and you want to contact the S&P. That's either Central Medicare or ourselves. And we will, this is free, it's confidential, and we will help figure out whether there's something that needs to be investigated. Again, we're the SHIP and S&P office. Kristen Harvey is the one employee. If you call her number or contact her in the email, she is the one who would set up any appointments with any of the rest of us, the volunteers. We're free local help for people. Take advantage of it. We're here to help you get educated and make the right decisions up front. This is the income-related adjustment that I talked about earlier. If you are more than certain income, and depending on your tax status, how you file, then you would pay more than that $164.90 for your Part B premium each month. As you can see, the amount goes up and can go up pretty significantly. If you are, this is based on income from 2 years prior. So if you retired and your income dropped significantly, you can appeal to Social Security for why you should not be being charged that amount. There is also an income-related adjustment on Part D if you make more than a certain amount. This one's a little different in that the figures you see there, you would pay your plan premium plus the amount that you see in that right-hand column. If you have questions on the presentation after you've listened to this, please feel free to contact Kristen, and we will look forward to being able to help you. Hopefully this has been helpful. If you did not hear part 1 before this, then you might want to go back and do that to make sure you get enrolled appropriately. Other than that, I appreciate your attention and good luck with your choices. Thank you.